Back in June 2021, something happened in the Pacific Northwest that honestly really shook me. We saw this heat wave that didn't just nudge records, it completely smashed them. Temperatures shot past 49 degrees Celsius, that's over 120 Fahrenheit. Places like Portland, Vancouver, cities I always thought of as, mild temperate, suddenly they were, well, danger zones. And the human cost was just awful. At least 868 people died. Many were in homes without AC. It happened in a part of the world that just wasn't prepared for that kind of heat. It really made me stop and think.
So this deep dive, we're looking into what our sources are telling us about this deadly new kind of heat wave that seems to be emerging globally. Experts are calling it the most lethal force of climate change. And honestly, looking into it, I get why. Our mission today is to unpack the science here, look at some really quite staggering future projections, and explore, well, what can we actually do about it? What solutions are on the table? We're drawing a lot from a BBC Science Focus article, a real eye-opener titled "New York is in the Firing Line."
How a deadly new form of heat wave could make Earth's cities unlivable. Okay, let's get into it. When you think climate change, maybe you picture, I don't know, huge storms, right? Or floods, those big dramatic events. But the sources we've looked at point to something different, something quieter, maybe, but much more lethal.
That's absolutely right. The numbers are quite stark, actually. In 2024, here in the U.S., extreme heat killed more people than hurricanes, floods, and cold weather combined.
Wow.
Yeah, it really is a silent killer. It doesn't always have that immediate visual drama of a storm, but the cumulative toll is immense.
That statistic really drives home the silent killer point. So what is it about heat fundamentally that makes it so dangerous, and maybe why is it so often underestimated compared to, say, a hurricane?
Well, our bodies are usually brilliant at keeping cool. We sweat, blood flow goes to the skin, heat escapes. Dr. Tom Matthews at King's College London explains this really well. We can handle pretty much any environment on Earth like this as long as we're shaded. But the problem starts when it gets very hot and very humid. That process, it just gets harder and harder.
Okay.
And here's the crucial part. There's a point where it flips. The atmosphere actually becomes a heat source for our bodies for extended periods. So instead of releasing heat, we start absorbing it, or at least we can't get rid of our own excess heat. Our internal cooling just gets overwhelmed.
Ah, okay. So the system breaks down.
Exactly. The body gets heat stressed, and that leads to all sorts of problems. It hits people with existing health conditions hardest, the elderly, the poor. The WHO highlights the strain on the heart and kidneys particularly. It can cause rapid death, hospitalization. And then there are the indirect things too, like more accidents, worse air pollution episodes that often come with heat waves affecting breathing.
So it's not just about feeling hot, it's this internal mechanism failing. And importantly, it's not just about those vulnerable groups, is it? The sources emphasize there's a threshold, a combination of heat and humidity, where it becomes dangerous for everyone, even if you're healthy, in the shade, drinking water. Which brings us to this concept I found fascinating: wet bulb temperature. It sounds technical, but the sources frame it as this key benchmark for, well, human survival limits. Can you break that down? What is it and why is it so critical? How's it different from the heat index we usually hear about?
Yeah, the wet bulb temperature is really fundamental here. Think of it like this. It measures the lowest temperature your skin can reach through evaporation, through sweating. It basically combines air temperature and humidity to show how effectively your body can cool itself. Like wrapping a wet cloth around a thermometer bulb. That's the idea.
Okay, got it.
When the air gets too hot and too humid, evaporation slows right down or even stops. Your body just can't shed heat anymore.
Right.
And the critical limit, the point scientists really watch, is a wet bulb temperature around 35 degrees Celsius. That's 95 Fahrenheit. When you hit that, even if you're healthy, resting in the shade, plenty of water, airflow, your core body temperature will just keep rising uncontrollably.
That sounds terrifying.
It is. It can be fatal in just a few hours. Yeah. And we've seen a few places, like Chakobabad in Pakistan, already briefly touch this threshold. Now, your question about heat index versus wet bulb, it's a good one. Wet bulb is about that hard physical limit of cooling. Heat index is more about what the temperature feels like to us, combining heat and humidity for comfort or perceived stress. And heat stress itself is maybe a broader term we use, looking at the impacts over longer periods, even before you hit that absolute 35 degrees C wet bulb limit. Because let's be clear, heat is dangerous well below that point too.
That distinction makes a lot of sense. So understanding this physical limit is one thing. But looking ahead, what are the projections saying? How widespread could these dangerous conditions become?
Well, this is where Dr. Matthews' research really paints a concerning picture. It was published back in 2017. even if we manage to limit global warming to 2 degrees Celsius, about 3.6 Fahrenheit, his work suggests over 350 million more people could face deadly heat stress each year by mid-century.
350 million additional people.
Yeah. And the area is already hit hard. The Indus Valley in Pakistan, the Persian Gulf, parts of India, Northwest Africa, bits of Mexico, and the southern U.S., they'd see it expand significantly.
And what if warming goes higher, say 4 degrees?
Then it gets much worse. With 4 degrees Celsius, or 7.2 Fahrenheit, warming, nearly 80% of the world's biggest cities could face regular episodes of dangerous heat. They specifically mentioned New York City. It could see, say, 5 days a year where the heat index that feels like temperature goes over 40.6 degrees C. That's the U.S. National Weather Service threshold for dangerous.
Wow. New York.
Yeah. Dr. Matthews used this really striking analogy. He said, if you get 4C, it jumps. It's like a cancer spreading, with dangerous heat emerging across North America in the mid-latitudes.
That image of it spreading like a cancer, that's chilling. It really conveys the scale up. But okay, these projections, 2 degrees, 4 degrees, how certain are they? What are the big variables? Especially when you hear things like the UN saying current policies put us on track for more like 3.1 degrees warming anyway.
That's a really important point. There is a lot of uncertainty, mainly around what we do next, Emissions pathways. Policies could change, for better or worse. Maybe targets get dropped. Maybe fossil fuel use ramps up even faster. But what Dr. Matthews emphasizes is that even these really severe scenarios, they are absolutely physically plausible this century. It's not some sci-fi fantasy. The physics allows for it if we stay on certain paths.
Physically plausible this century. Okay, so given that stark reality, the big question is obvious. What can we actually do? How do we fight back against this?
Well, the knee-jerk reaction is often air conditioning, right?
Right. Seems logical.
But it's a double-edged sword. The International Energy Agency projects global AC demand could triple by 2050. Meeting that demand, it would need as much new electricity generation as the entire U.S., EU, and Japan combined produce today.
That's staggering.
It is. And so you get this vicious cycle. More AC means more energy use, often fossil fuels, which means more emissions, more warming, which means you need more AC.
Ah, the feedback loop.
Exactly. Plus, lots of people can't afford it. And what happens during a power cut? Which, ironically, can be more likely during extreme weather events, like heat waves.
Yeah.
So AC isn't the silver bullet.
Okay, so if not just AC, what else? You mentioned forecasting earlier.
Yeah, we need to get smarter with forecasting. Our weather forecasts for temperature and humidity, they're actually really good. But what we're often missing are good impact forecasts. Forecasts that tell us not just how hot it will be, but what that heat will do.
What it will do, like mortality.
Exactly, like predicting expected mortality or hospital admissions. That's harder because it depends not just on the peak temperature, but how long the heat wave lasts, the time of year, stuff like that.
Makes sense.
And we need much more granular forecasting, hyper-local, not just for the city, but street by street, maybe even building by building. Dr. Matthews talks about using modern tech for this super cheap temperature sensors everywhere, smart home data, maybe, getting that really fine-grained picture to help people and health services react precisely where needed.
That sounds incredibly useful, like targeted warnings. What about changing the cities themselves, physically?
Absolutely critical. City planning is huge. We need to redesign urban areas, think green roofs, reflective surfaces to bounce sunlight back, more trees, parks, accessible public cool spaces.
Green spaces, yeah, I saw a stat about that.
Probably the Lancet study from 2023. It was striking. It found that over a third of heat-related deaths in European cities could potentially be prevented just by increasing tree cover to 30% of the urban area.
A third, just from trees.
Yeah. It shows how much power these sort of nature-based solutions can have. So the real key for solutions is this mix. Smart urban design plus that predictive impact forecasting. Knowing not just how hot, but how deadly, and changing our environment to cope.
That tree statistic is really powerful. It feels so doable somehow. But are there big hurdles to making these changes widespread, like beyond just knowing what to do? Politics, cost?
Oh, for sure. There can be significant hurdles. Cost is always a factor, getting political buy-in, navigating the sheer complexity of redeveloping parts of a city. It's not trivial. But the argument is that the long-term savings in healthcare costs, in lives saved, in economic productivity likely far outweigh those initial investments. It's about shifting perspective. And one more thing, crucially, is communication. We need a total rethink on how we talk about heat waves.
How so?
Well, think about hurricane warnings. They're serious, urgent. News reports show the danger. But often, with heat waves, You still see pictures of people sunbathing on the beach, having fun.
Right, minimizing the risk visually.
Exactly. It sends the wrong message when actually thousands might be suffering or even dying in that same event. We need clear, consistent, serious communication about the real dangers.
That's a really vital point. So putting this all together, the rising threat, the potential solutions, it leads to the big question, doesn't it? Are we? Are we doomed? Is it too late?
It's easy to feel that way sometimes, looking at the projections. But Dr. Matthews actually offers what he calls a cautiously optimistic view. I found that quite interesting.
Cautiously optimistic. How?
Well, he acknowledges the hazard. The extreme weather itself is definitely getting worse, no question. But he makes this crucial distinction. The translation of that hazard to impacts is far from assured. Meaning, just because the weather gets worse doesn't automatically mean the death toll has to rise proportionally. And he points to history. Think about it. Global population has exploded since the early 1900s. Yet, total deaths from all natural disasters have actually gone down significantly over that time.
Wow, that is surprising, despite population growth and presumably more people living in vulnerable areas.
Exactly. It shows that adaptation, preparedness, early warning systems, better infrastructure, all that stuff works. We have agency. We're not just passive victims.
That suggests we can make a difference, even with worsening conditions.
Precisely. So his concluding thought is quite hopeful, though he adds that caution. He says, there is so much we can do to mean that the future, even if it's warmer than we would like, is better than it is now. No, Bo. It really puts the focus back on our actions, our choices, our ability to adapt to build resilience.
What a journey. From the shock of that Pacific Northwest event to understanding wet bulb limits, future risks, and potential solutions, it's sobering, but also maybe empowering. The big takeaway for me is yes, extreme heat is this silent, deadly force amplified by climate change. It's real. But understanding the mechanics like that critical wet bulb temperature threshold, our physiological red line, and focusing on smart solutions, that's key. Things like hyperlocal impact forecasting, knowing not just the temperature, but the actual danger level combined with physical changes like urban greening, planting more trees. These can genuinely save lives. So maybe the thought to leave you with is this. Knowing the scale of the potential heat, knowing we're on a path towards pretty serious warming, what could it mean if we all had a better grasp of concepts like wet bulb temperature? How might that change how you or your community prepare? And how much potential lies in those seemingly simple nature-based ideas like trees transforming our cities into cooler, safer places? Something to think